I'd like to talk a little bit about this surgical band that we use oftentimes. This surgical band is actually made for breast augmentation, for implants, but we can also use it for other things, which I'll talk about in a minute. Now, this is basically just a strap. It's just a strap like this that closes. And the idea that it was made for is occasionally when you have implants under the muscle, these implants start off actually quite high. Yeah? So when the implants are high and they're under the muscle kind of holds it up, and we can use this band to tie it on top to bring the implants down. So I'm going to show that right here, okay? This goes up here like this, and what this does is that it actually pushes the implants down to the proper, so if the band is up there, it pushes the implants down to the proper position. Now, a word of caution here, if the implants are above the muscle, it is so important to be very careful with these bands, because when implants are under the muscle, they want to stay up, but when implants are above the muscle, they want to sag, okay? So when the implants are above the muscle, and even if they're high, I'm very careful with banding, and actually don't necessarily recommend it. So it has to be followed very closely with your surgeon. Now, what if you've done a surgery and your implants are up here, and I often find people, for example, if you're right-handed and you're using your right hand a lot more, this implant comes down faster than the left implant. Here in this situation, what we can do is the implant that's high, we can band it downwards like this. So the band actually is only on one part of the implant. For example, if this implant is high and this implant is low, you can band that to push this down without affecting this. You should not go across like this because it'll bring this down even further. So the idea is just to bring one down, in which case we bring the band above the high implant and underneath the left implant so that they ultimately balance out. If you have an implant which is sort of too far in on one side, and it's okay on the other side, then we often put the band in this situation to sort of push it out like that. For example, here you can go across the shoulder and push this so that the implant, if it's too far in, can get pushed out. Now, these things are very important to do with very, very close follow-up with your plastic surgeon, because you can overshoot, meaning if you put the bands and you leave it in for a long time, then actually the implants can sag and come down too much. So you have to keep a very, very close eye on these things. And in general, we tend to recommend the bands for implants that are under the muscle, and I would be very, very careful using it when you're using implants that are above the muscle. So another situation where we can use this, then in a situation other than the breast, is, for example, in the abdomen. When we do an abdominoplasty, if you have a specific area where there's fluid collection, especially in the upper abdomen. So for example, if this is your abdomen and you've had an abdominoplasty and you've removed the drains and there's some fluid collection here. And in general, in plastic surgery, whenever you have a fluid collection, you need to sort of create some compression over it. And in this area, it could be a little bit difficult to create compression, and this is where this comes in. You could potentially put the band across here. For example, you can put pressure just in this area to create pressure to help with any seromas or any fluid collection. In summary, these surgical bands are actually very helpful in plastic surgery, but it's so important to be careful with it. Try to use it mainly for implants that are under the muscle, that are very high. The way they're placed, if there's any asymmetry of the implants, it's important not to press both down at the same time, because you want to push one down more than the other side, for example. So it's so important to actually use these with the help of your plastic surgeon.